Ontario's Minister of Health, joins me this morning on 1310 News. Good morning, Christine Elliot.
Good morning, Rob.
It's very nice to hear from you this morning, ma'am. Let's talk about, begin with the fiscal update yesterday. Overall, it is a $17 billion aid package announced yesterday by the finance minister. Specifically, What is healthcare related?
Well, there's $3.3 billion worth of support for healthcare because we know that we are going to need to take significant action to try to flatten the curve and with the transmission of COVID-19, and of course to treat the people who unfortunately have contracted it.
Okay. And how will that money be deployed throughout the system?
Well, there's going to be $2.1 billion in new measures in addition to the 1.2 that had already been approved by Treasury Board. But there's also going to be a dedicated $1 billion contingency fund for COVID-19 because, unfortunately, we don't know how long it's going to last. But there will be almost $1 billion going into our hospital system to be ready for increased pressures, increased numbers of people coming into the hospital, and to create more spaces for patients coming in hospitals across the province. So
numbers like, you can just tell me if these are accurate or not, 1,500 new hospital beds, for example.
There won't be 1,500. There'll be more, like several hundred more hospital beds.
Okay,
but it's to be prepared to use them. And one of the things that we're going to do is to try to move some of the people who are in hospitals right now but don't need to be there. They're waiting for a placement in a long-term care home or to go back into their own home in the community. We're going to try to find appropriate, safe, comfortable places for those people, and then we will have greater capacity within the hospitals to accept new patients.
Right.
And we are creating some new spaces by opening up some spaces in hospitals that may have beds available. So there will be work that will be needed to be done to get those beds ready to receive patients.
Yeah, this is something I talked about yesterday with your colleague at long-term care, Dr. Fullerton. You have people who are in hospital who should really be in long-term care, but there's no space in long-term care. So maybe the temporary measure might be if you can find appropriate space and appropriate care can be rendered, a hotel setting or something like that. Is that what you're thinking of, Minister?
Yes, we're looking at alternative spaces. It could be in retirement homes if they have spaces. Could be in hotels. We are looking at hotel arrangements in several locations in Ottawa, Toronto, and other places to be able to receive the people who are alternate level of care, most of whom I would say are seniors and are particularly susceptible to COVID-19. So we want to make sure that we're going to build all of the necessary safeguards in place to make sure that their health is protected.
Okay. There are many stories this morning, Minister, and I'm sure you're aware of them, of frontline healthcare workers being asked to ration what's become known as PPEs, personal protective equipment, that supplies are running out and new inventory is nowhere in sight. What are you doing about that?
We are working on that 24/7, and we do have personal protective equipment for all frontline workers who need it. We are obtaining new sources first of all, from our regular suppliers, but we've also asked the federal government to work with us, and they are, because they can have quite large purchases that they are able to make, and they have indicated that they will be distributing that among the various provinces and territories. And we've also reached out to Ontario companies to help us through Ontario Together, the new website that's been set up. Anyone who has supplies of N95s, the fitted masks that mostly nurses, physicians would wear. Those masks we're asking Ontario manufacturers to make those. The protective clothing that our frontline workers need, the gloves, face guards, all of these things. We are working together, and we're receiving a lot of equipment and supplies, first of all, through Ontario Together, but also we're working with organizations like car part manufacturers who are working to help us build ventilators, because we know that we will need those as well in our hospitals. So we are working on that. We have a separate group within the Ministry of Health that is all they are doing.
Okay. It must be frustrating to be the Minister of Health, and you look at the Toronto Star and you see a Rosie DiManno column that says we had 50 million of those masks and they were destroyed. They were in storage, but they were destroyed. They were left over from SARS. As the current Minister of Health, what's your reaction to that?
Well, we actually had in Ontario about 1 million expired N95 masks that were to be destroyed because they were expired. However, they weren't destroyed. They can be used. They can't be used as N95, the fitted masks, because they are expired, but they can be used as surgical masks. So that means that they can be used for other purposes. So they're not going to waste. Okay. We are using them.
All right.
We can't use them for the original purpose, but we can use them as surgical masks.
Okay, they can be repurposed.
Absolutely,
okay.
Yes.
Boy, the days have gone by so fast. I'm not sure when it was announced. Premier Ford announced he wanted to backfill 1,000 nursing positions. Anything to report on that front?
We have been able to hire a number of nurses to help us with in our assessment centers, which are for the testing of COVID-19. Okay. We also have hired nurses to help us on telehealth, our call center line, so that if people have health concerns, they can call and speak to someone who can speak to them about their symptoms and advise them whether they should come to an assessment center or not.
Okay.
So we have been working very closely with the Registered Nurses Association of Ontario in particular, who've helped us with that. The Ontario Nurses Association has also been very helpful. We're working with all of our partners in the health sector because we need everyone.
Sure.
This is not a situation where you sit back and wait, and all of our health partners have been extremely great in mobilizing both the health human resources as well as some of the equipment that we need.
Okay. I was just curious. I would imagine some of these are retired nurses, right? Some of them are retired. Is that right? Or?
Yes.
Yeah.
Some of them are, and some of them are
people who are just about to become nurses, maybe just a little bit shy of officially becoming a nurse, or.
Well, we're asking for nursing students to help us out as well.
Okay.
We're not asking anyone to work outside of their scope of practice, of course.
Right.
But there are many, many jobs that need to be done, and people are really stepping up. And I really, we're grateful for the assistance that so many individuals and companies in Ontario have done to help us in this battle against COVID-19.
So what can be done to narrow the testing backlog, to whittle that down? I think it's at 10,000 or something like that.
Yes, we have a plan in place to increase our testing dramatically within the next week because we know that there are many people who are waiting for tests, and to have to wait 5 days for the results of a test is not acceptable. It should be more like 24 hours. That is what we're working on very diligently at the ministry to get more labs involved in the testing. Originally, it was Public Health Ontario's lab. It's expanded to hospital labs, but now we're asking labs across the province to assist us with the testing for COVID-19.
Okay. Thank you for your time. Best of luck to everyone.
Thank you very much.
Thank you very much. Christine Elliot, the Minister of Health in Ontario.